Why belly fat is so dangerous, even if you're not overweight. If you look slim, wear a small size, or your weight seems normal, you might think belly fat isn't a big deal. But here's the truth. Belly fat is one of the most dangerous types of fat, even if you're not overweight. Today, let's talk about why belly fat is risky, and what you can do about it. First, what exactly is belly fat? There are two types of belly fat. The fat you can pinch under your skin is called subcutaneous fat, but the more dangerous one is visceral fat. This fat sits deep inside your abdomen, wrapping around vital organs like the liver, pancreas, and intestines. Visceral fat is the real problem, and you can have a lot of it even if you look slim. Why is belly fat so dangerous? Unlike other fat, visceral fat is biologically active. It releases inflammatory chemicals and hormones that interfere with how your body works. Danger 1. It increases the risk of heart disease. Visceral fat raises bad cholesterol, increases blood pressure, and damages blood vessels. This significantly increases the risk of heart attacks and strokes, even in people who are not overweight. Danger 2. It raises the risk of type 2 diabetes. Belly fat makes your body resistant to insulin. This causes high blood sugar levels and puts you at a much higher risk of developing diabetes. Danger 3. It disrupts your hormones. Visceral fat affects cortisol, insulin, estrogen, and other hormones. This leads to more fat storage around the belly, mood changes, fatigue, cravings, and difficulty losing weight, creating a dangerous cycle. Danger 4. It increases inflammation in the body. Chronic inflammation damages organs over time and is linked to conditions like arthritis, fatty liver disease, autoimmune issues, and even some cancers. Danger 5. It affects your liver. Excess belly fat can lead to non-alcoholic fatty liver disease. This condition can quietly progress without symptoms but may cause serious liver damage over time. Why you can have belly fat even if you're not overweight. You don't need to be obese to have dangerous belly fat. Causes include chronic stress, poor sleep, high sugar and processed food intake, sitting for long hours, hormonal changes, genetics. This is sometimes called being skinny fat. Normal weight but unhealthy fat distribution. Signs you may have excess belly fat: a growing waistline, tight clothes around the stomach, frequent bloating, low energy, sugar cravings, difficulty losing belly fat despite dieting. So how do you reduce belly fat safely? First, manage stress. High stress increases cortisol, which pushes fat storage to the belly. Deep breathing, prayer or meditation, walking, and proper rest help lower cortisol levels. Second, cut back on sugar and refined carbs. Sugary drinks, pastries, white bread and snacks spike insulin and promote belly fat storage. Choose whole foods instead. Third, eat enough protein and fiber. Protein stabilizes blood sugar and reduces cravings. Fiber feeds gut bacteria and reduces inflammation. Both are essential for reducing visceral fat. Fourth, improve your sleep. Poor sleep increases hunger hormones and belly fat storage. Aim for consistent, quality sleep every night. Fifth, move your body regularly. You don't need extreme workouts. Walking, strength training, stretching, and daily movement all help burn visceral fat and improve insulin sensitivity. Belly fat is not just about appearance, it's about health. Even if the scale looks fine, excess belly fat can silently damage your body. The good news? With simple lifestyle changes, visceral fat responds well and can be reduced. Take care of your waist, not for looks, but for your life.